My name is Antonia Trichopoulou. I'm a medical doctor. I spent the first life of my medical profession practicing and in parallel working in the university. And after some years of practicing, I was totally devoted to teaching and research at the university. And slowly, I moved to work more and more and more on the Mediterranean diet in general. I started actually working on lipids and cardiovascular diseases, and then slowly I moved to the Mediterranean diet. And now I am retired, but still I'm working because I love my work. It started because I was, let's say, angry, because in Greece we start cutting the olive trees. And then after Ansel Keys, you know, the great Ansel Keys, who described the Mediterranean diet, he said that the Mediterranean diet was good because, he was correct of course, of its low saturated fat content. And then the countries which they have cardiovascular diseases, rightly, they did a big campaign, like in Finland, and they replace the saturated fat, namely butter or lard, with seed oils. In Greece we were consuming olive oil, and we have the better health indices in this big study. The lower mortality rate from cardiovascular diseases and many other chronic diseases. And then they start moving and advertising seed oils in Greece to reduce your cholesterol and to reduce the incidence of the heart disease, which was crazy. The people didn't like that. But they said, okay, I mean, we have to do that because it's for health reasons. The medical doctors, they are promoting also this. So I said, no, this is not correct, because I realized that then it was not feasible to have Mediterranean foods. At that time I was asked by the mayor of Athens to develop, I was medical doctor working in lipids and nutrition and so on, to develop the menu for school children. And then I realized that it was impossible to follow the rules of the World Health Organization, which they say 25 to 30% of your daily caloric intake should be from lipids. But when you want to cook and to apply the traditional Mediterranean cuisine, then the olive oil contributed much more to the total caloric intake. But why? Because it was consumed with vegetables. And all these things, I was a young doctor without any power. Then I start asking here and there, and I said, here is something wrong, because our people is healthy. Why to change our traditional diet? And besides that, the Greeks, they didn't like the seed oils. And then, if you cook the traditional Greek diet with seed oils, which is very thin, and they don't have the aroma, they don't as well. You cannot eat. I cannot eat traditional ladero, as we call these dishes, because ladero, and it's worthwhile mentioning that now, ladero comes from the word ladi. Ladi in Greek means olive oil, and the ladera are the dishes prepared mainly with olive oil. It's prerequisite to use of olive oil. It is a series of dishes cooked in olive oil, which they are called laderites, all the vegetables and all the legumes. So slowly, I was very much interested, and then I was a young Mediterranean from Greece, and then going to the big university, and then asking questions. They were telling me data, we want data. It's impossible. Mediterranean diet is a fattening diet. it took us 20 years to start, providing data and start discussing, not persuading, but bringing the issue, because for many years they didn't want to answer. They was looking what she's saying. 40 years ago, something like that, even in 67, actually, it was my first visit in California, many years ago. As a student, I was here, and I visited California. And then I said, my goodness, look which kind of olives they have. They are big, they shine, they are clean. And our olives in Greece, they are dark, they are shrinked. So I was impressed. I said, this is the olives of the world. But when I taste them, you close your eyes, you do not understand if you're eating olives or, something plastic. No taste, not aroma. And then slowly I discover for myself, because of many others say the person who they are working on that, they know that it's very important, the way of processing the olives. And it's both from a point of view of taste and a point of view of nutrition value. Because if you are processing and you debitter the olive oil very fastly, then you destroy the antioxidant capacity of the food. But the slow processing with salty water, which takes 2 or 3 months, and which is the traditional way, keep a lot of the nutritional value, and they are much more tasty. So today, in one of the tables in the exhibition, I saw all this small box which you see over there. And then I taste the olive. I said, my goodness, this is traditionally treated here in California. I asked it, was a man. He said to me, yes, I am Italian, and I'm doing the Italian way from a small city near Rome. It's a tiny factory. I said, but it's wonderful what you're doing. Even in Europe now, even in Greece, we do not cure this way. So, this openness in California, this openness of the people to try something new. So I said, God bless you and go ahead. The future is yours, and the future is for olives. It's understudy, and we do not know many things, and the good olives, which are not salty, they offer equal amounts of nutrients, if not more, than the very good olive oil. I think that's the future. Work on olives. And then, for example, in Greece, olives, our breakfast, it was bread and olives. It's a Mediterranean diet in a bite. All Greece is here in this olive. That's my story.